So today we're going to be speaking about navigating those mental health resources support online and locally in our Windsor-Essex County community. So the reason that we really wanted to focus on those online resources, I know for myself, there are so many mental health apps, online resources that, there's a growing number, and sometimes it's a bit challenging to know which ones are safe, which ones are reputable, which ones are effective, and I don't want to be spending my money only to learn, oh, this wasn't the type of app that I was really looking for. So what's neat about this webinar is that, we really collected all those, apps and online supports that do have a lot of evidence-based applications. They are confidential, there's privacy in place, and we'll kind of go through that. So I will start. So the very first app, I will go through this rather quickly, but I have made it visually there so easy for individuals to kind of see when you're looking in your phone to kind of download the apps. So the Wellness Together Canada, this is not an app, but this is the government's website, right? So it's really, I think it was launched last week or the week before. Very great website. So it's mental health and substance use support. It has tons of tools, resources. They have modules for addressing low mood, worry, substance use, social isolation, relationship issues. So right away, when you go on to the Wellness Together Canada, you can scroll down, and then what's really neat is they will have those helpful resource tabs, and you can click on adults or youth. And then let's say you are on there and, you'd like to really speak to someone immediately. They need it. They do have that immediate support right there, text wellness for youth, and that really directs you back to the kids' help phone, and then text wellness 741, and that's for our adults. And then I'm going to go and speak about kids. So the Kids Help Phone, it is one of my all-time favorite websites. I absolutely adore the ease and just how easy it is when you get on the website to kind of access those supports, whether it's supports, resources, it doesn't matter. So Kids Help Phone does have an app, and I've provided that picture. The app is called Always There. And what does it allow? The app really just allows someone to access the texting support, the phone support, the live chat right away through the app. Do you not need to download the app? Absolutely, you don't need to download the app. You can go onto the Kids Help Phone website. They have a plethora of resources. It's a really great website. And they also do provide various modalities if someone is needing support via phone, chat, or text. Mindshift. So Mindshift is an app that is based from BC. So it's with Anxiety Disorders Association of British Columbia, and it's in collaboration with Children's BC. Mindshift is really for those individuals that, are finding that anxiety is starting to really, prevent or get in that way of being able to do those things that you normally do. If you're seeing that the anxiety right now has increased and you're finding it hard to manage, this is really, it's really using those cognitive behavioral therapy tools to really help someone learn to coping strategies, right? So to help someone tackle those instances of those worrying thoughts, panic attacks, social anxiety, phobias. Again, this app is free. It's available to download as well, Kids Help Phone. If any of the apps that I am speaking about do have a charge attached, I will try my best to let you know that ahead of time. We've tried very, very hard to simply include all those apps that really are free of charge. The next app, it's a really great app. I really highly encourage everyone to download it on your phone. You know, we have a YIP. It is Youth in Partnership. It is a youth group that is through Hotel Dieu Grace Hospital, RCC, and they have paid. So when it says a publicly funded service in Ontario, what that means is we have paid to be able to offer the Be Safe app within our Windsor Essex County community. What does that mean? It means that the information to supports, resources, important numbers are updated for the Windsor Essex County community. What's really cool about the Be Safe app is it really allows anyone to create their own safety plan. Or let's say you're with someone and you're starting to notice that, you know, maybe that friend, a family member, you know, they need help in accessing supports, or, you know, it is a crisis where you're really unsure of someone's safety. You know, having that app on your phone, you know, you can click it right away where you're saying, I need help, and they'll direct you instantly in securing those numbers that sometimes, you know, we need absolutely, you know, in that immediate, like in the immediate moment. Calm. So I've heard a lot of fabulous things about Calm. I will be honest, I have yet to download it, and I think the reason that I've always refrained from downloading Calm is because, like I mentioned, there are so many free apps that I really want to utilize all those free apps. So Calm is free, but if you would like, I believe if you want access to more of the meditations and the breathing, relaxation, I think there is an added charge. So Calm is really to help individuals improve sleep, help someone feel, learn how to do some deep breathing, introduction to relaxation practices, meditation, and yeah, that's about it. It was awarded the best app of the year, and I do know a lot of individuals that have said it really is just something really great to, you know, when you are feeling stressed in that moment, to just kind of open up the app and go through, you know, possible strategies that might help you in that moment. Moody. So Moody is another really cool app. So this one's in partnership with Mood Disorder Society of Canada. I really like this one. You know, I usually speak a lot about get to know yourself, get to know, you know, what stresses you out. How do you know you're stressed? Where do you feel it in your body? You know, do you know, what happens with your mood, you know, if you haven't slept, physical activity, you know, so this mood tracker is so neat because it helps you, it tracks your food, your sleep, hygiene, physical activity, self-care, all of this stuff. And it's kind of getting you to get to know yourself better. And what's really cool is that it was designed to complement other mental health services. So what do we mean by that? It's pretty neat. So let's say you've been tracking your mood for 30 days and you start to see, oh my goodness, I'm seeing a pattern. I've gotten to know this type of, you know, this is when I feel I'm at my best. This is when, you know, my mood has been lower. I want to discuss with, you know, a health professional. You can show that health professional that data to be able to, you know, really advocate and let someone know this is what's been going on. Because sometimes, like we all know, we might get to an appointment and we have everything ready to say, and then we completely forget some of those important things we'd like to talk about or address. So it's a really great app. Again, absolutely free. Moods. Moods is another app, pretty cool. It is the exact same thing as Moody. So it's for tracking your moods and psychological well-being. And again, like I mentioned, it really is an empowering way to identify triggers, to get to know yourself. You know, because you are the world's expert in your mental health, wellness, recovery journey. So it's super straightforward. I like it because it's really visually appealing, and it's just like a tap, 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 done. So every day you would sit, you know, you see it like below, how do you feel? You know, they have a list, and then they have so many adjectives to explain, or if you don't like the words, they do have emojis to better explain it. And again, it keeps track of those emotions and how they may fluctuate from day to day. Headspace. So this is a very popular app, and it really guides users through meditation and mindfulness practices. Again, this is free with limited resources that are free. If you upgrade, apparently there are hundreds of guided meditations, relaxation, and again, all for free. So a really great app. Love it. I like that it is kind of easy to use in nature. Some of the apps that I gravitate more towards are those ones that are very easy. And this is one of them. So Headspace. What's up? So What's up is very cool. I have to definitely speak to our HR department as well, because it'd be kind of something neat. So this app is designed to really improve the psychological well-being across an organization or within an organization. So what does it look like? Users can send an alert to an HR to let them know if a colleague's in distress or if you're concerned. You can also send and receive messages from a team if someone needs help coping. You know, it also has the mood diary function. It's just kind of neat. So does it have to be a whole organization? You know, no. You could just think, wow, this is pretty cool. I'm going to set this up with myself and 5 of my close friends, or my circle of care. It doesn't matter, you know, it doesn't have to be for an organization. It's really cool to keep kind of everyone in that loop. So there we go. Okay. Healthy Minds. Healthy Minds is, again, really awesome. It is free, and it is a problem-solving app. It really is, I'd like to say, more geared to our youth that are on campus or off campus. And what is the goal of it? Again, the goal is really to get to know yourself, you know, keep yourself feeling in balance, like balanced, you know, and trying to figure out, you know, when you are feeling stressed, what's going on, what's the trigger, what's the stressor, and what are those coping strategies that you can access. So it really just helps youth problem solve and try to figure out, you know, what can I do right now in the moment to just reduce that stress or fear, sadness, worry, the list goes on and on, right? Big White Wall, one of my all-time favorite, and simply because when people ask me, well, why is it your favorite? I have spoken to so many individuals with lived experience that have truly explained to me how much support and how far they went in their recovery journey, simply with, you know, having that peer-to-peer support. That's so powerful, right? When we're able to connect with someone that's also, you know, experienced maybe perhaps the same setbacks, the same symptoms. You know, for someone that has been frustrated, let's say accessing supports or trying to advocate, you know, to be able to, you know, be in a support group that you're hearing from others with lived experience, you know, how this worked or that didn't work, or it's so powerful, right? So this is free. It is through OTN, so Ontario Telehealth, telemedicine. And why we also love it is it's for anyone over the age of 16. And the minute you go into it, so this is completely free. It is online, bigwhitewall.ca. And there's so much that you can do within Big White Wall, such as online courses. Again, support groups, right? So let's say, you know, you're dealing with a certain symptom you find that is really distressing, and you've tried so many things, but right now you're just like, I just want to feel like somebody is understanding. You know, you can just search whatever it is that's going on within the Big White Wall. And then if there is a support group that comes up and pulls out those, whatever you've searched, they'll pop up, and then you can join those support groups. This is monitored 24/7 for everyone's safety. And it is monitored by trained clinicians. And that is just to ensure the safety within Big White Wall. You don't have to worry about, there's no bullying, is complete support. So there's the online tutorials, courses, support groups, and there's an added piece about Big White Wall, as in bricks, white bricks. So it's a collage where, you know, every day you can draw, you can put a picture, you can, you know, post whatever you want in creating your own wall. So it is beautiful, wonderful. Highly encourage individuals to sign up. It's absolutely free for anyone residing in Ontario. Last but not least, we have Bounce Back. So Bounce Back, again, this is free to all individuals residing in Ontario, and we love this course as well. It is for youth 15 and up. There are so many languages now. I'm maybe Evelina, when she starts to speak very shortly, maybe she knows the exact amount of languages, but the last time I checked, for some reason I keep thinking 48, but I could be totally wrong. So here's what Bounce Back is. Bounce Back is a self-help program, or instead of self-help, let's call it skill building program, to help anyone over the age of 15 that right now might be struggling with low mood, anxiety, stress, anything that you have started to notice. It is starting to, you know, get in the way of that day-to-day functioning. It is preventing you from enjoying things, preventing you from, you know, being able to do those things that you normally would do. This is for individuals that are experiencing that anxiety and depression and stress, mild to moderate. And, you know, two modalities. Let's say you're really not sure if you're not sure about the program. You can log on right away to bouncebackontario.ca, and you can check out their free videos. And the videos range in, and I do know we have 8 languages. These videos do run in 8 various languages, and it will be on sleep hygiene. I'm sorry, I can't speak today. It will be on sleep hygiene. There also is a free video on, you know, how do thoughts and worries start to become overwhelming? So it really starts to give us an introduction in what Dr. Chris Williams, the inventor, the creator of the Bounce Back program, is the vicious cycle, right? How our thoughts, our feelings, our behaviors, our physiological response, all of that's kind of interconnected. I'm actually running a course very, very, very similar. It's actually the exact same course, but it's called Living Life to the Full. So what is the difference? Bounce Back you get to do from the comfort of your own home. And Living Life to the Full is a group format. Okay, so when you're doing Bounce Back via at home, you would need to call your healthcare provider, or you can simply call the 1-800 number. And you can, let's say you're all calling the 1-800 number, you can indicate, I heard this webinar, someone told me that, I should look into Bounce Back, I really want to get started. And would say, okay, well, let's start talking to you about, can we have consent to fax over your healthcare provider? And why do they need that consent? And that's simply because they're going to be assessing and rating your mood in what's called a PHQ-9. And that's just really just trying to gauge, how often and how are you experiencing those symptoms. And they also want to have that healthcare provider kind of there as well, because after you're done this program, they want to ensure that you are connected, whether it's with your healthcare provider, whether it's with, another community resource. It's very important that should you ever need any more resources, the healthcare provider has that information and you'd be able to follow. So that is Bounce Back. I'm trying to think what else I can say about Bounce Back. Okay, so like I mentioned, you don't need to call the 1-800 number. If you feel comfortable, you can call your family physician, your healthcare provider, and you can just simply indicate, I've heard about Bounce Back and I'm really interested. So the referral form, your physicians hopefully will have it. We've tried to, put that word out there. And I think, now Bounce Back has been around in Ontario for a bit now. A lot of healthcare providers know what Bounce Back is. And once you are in the program, you will be assigned a coach. And once every 2 weeks, you would have phone sessions, or for individuals that everything is, you're technically savvy. I don't even know these words I'm speaking today. I apologize. So they do offer the courses that they can send the booklets, either, a hard copy via the mail, and you'd have a phone session every 2 weeks, or really based on, what you and the coach decide, or it could be done via everything using ebooks and online as well. So that is Bounce Back. Pretty awesome program. I don't think I did it justice by actually explaining it, but that is it. So I am going to stop sharing my screen, and my colleague Evelina is going to take over.
All right, thanks, Jenny. So in terms of how many languages, I think the actual booklets and workbooks for Bounce Back is offered in 14 languages. And there are multiple, maybe 48 something, or even more now, coaches that speak different languages that you can talk to, but you might have to get the booklets or workbooks in English and speak with the life coach in a different language, depending on your native language. So just wanted to mention that real quick. So I want to shift focus from focusing on online resources to navigating local resource for mental health during COVID, during an emergency. And I'm going to talk about different resources locally in Windsor, Essex, specifically focused on Windsor, in terms of emergency, in terms of the non-emergency, in terms of urgent care. So first, I'd like to start and just mention that if anyone is experiencing an emergency, they should still go to the emergency department, and especially in these specific cases. So if someone is experiencing acute suicidal thoughts or self-harming behavior, substance-related intoxication, acute psychosis, urgent medical issues requiring emergency medical attention, severe alcohol dependency, or aggressive or violent behavior with risk to others, still call 911 or get EMS, or that person should go to the emergency. They may need to be admitted for 3 days to be assessed if the behavior and if they're having an actual crisis, an emergency. So I would just say, please just remember that is still a resource that's available. So that's during an emergency, a mental health emergency. The next thing I'd like to focus on is the Mental Health and Addiction Urgent Care Center. So imagine if you were to go to an urgent care center because you have a medical need that doesn't require necessarily an emergency department, but it might require an urgent care center. This is the exact same thing, just with regards to mental health. So it's urgent, but it's not necessarily an emergency. And this urgent care center for addiction and mental health is located at Canadian Mental Health Windsor, Essex, at 1400 Windsor Avenue. And I'm going to show the hours of operation and who this urgent care, who can access it. So anyone over the age of 16 who is experiencing an urgent mental health or addiction concern can voluntarily just go to 1400 Windsor Avenue. They do obviously the COVID screening at the front. There's primary health care there, and there is a group of multidisciplinary physicians, social workers, addiction counselors, nurse practitioners, and psychiatrists. And if the person requires a team of people to assist, they will be able to access those services right then and there at the Mental Health and Addictions Urgent Care Center. So the hours vary because on Mondays, Wednesdays, and Thursdays, Fridays, Mondays, Wednesdays, and Thursdays, we have longer hours, but they start a little bit later in the day. So it's 11:30 a.m. to 7:30 p.m. on those days. And Tuesdays and Fridays, it's regular business hours, 8:30 a.m. to 4:30 p.m. So anyone who may not require hospitalization, but needs maybe some extra support for an urgent care mental health issue, I would suggest they would access the Mental Health Urgent Care Center at 1400 Windsor Avenue. So that doesn't mean that other supports that have been in place for all this time in Windsor are still not there. They are still there. So I hope everyone is aware, and if you're not, the crisis line, 519-973-4435, is still available 24/7. Anyone with a mental health crisis that needs to speak with a social worker, it could be for lots of different reasons, suicide or self-harm. If, for example, the person is unable to or unwilling to go to the urgent care center at 1400 Windsor Avenue, they can go ahead and call crisis and be assessed on the phone with a social worker. What to expect: you're going to talk to a person. Sometimes you may not always get through right away. You might be put on hold. But I would just recommend that if anyone's experiencing some sort of crisis and they don't want to go anywhere and you're not sure whether to call EMS or the police, you could always call the crisis center with that person to support them if they're experiencing some sort of crisis, or encourage them to call the crisis line. So the crisis center and the Crisis Mental Wellness Center, also known as the Transitional Stability Center, is located at 744 Olette. This is still a place where if somebody's experiencing a crisis or they need immediate support, where there's persistent mental health with sudden emergency, but they're looking at navigating mental health or additional services in the community. Let's say they need some support because their finances have changed, or housing, or they don't know where to go, or they're experiencing a loss of some sort, and they just aren't sure what services are there. They can go there or call, and they'll be linked with a coordinated access person who will assess the situation and help them navigate those resources as well. And the person can also walk in 8 a.m. to 8 p.m. at 744 Olette, 7 days a week. So this is a great place to suggest if the person is unable to go, for example, to the urgent care center because it's the weekend. but 744 Ouellette is open 8 a.m. to 8 p.m. Also on Saturday and Sunday. So that's what I would recommend on those days. And accessing that area, there's parking in the back, and actually both areas, the urgent care center and the crisis center, has parking. So that's something good to know. And I heard the buses are going to be starting to run again, so it is on a bus route for both locations. So this is a new service that was started since we've been social distancing, and there's a coalition formed with a lot of different partnering agencies in Windsor, Essex, and they created this temporary support line for counseling support. So let's say someone's not in crisis, but they would like to talk to a counselor for whatever reason. It doesn't have to be a specific reason. It's support for anyone in Windsor, Essex. If they call, they will talk to a counselor. So that's the phone number. It's 519-946-3277. There's also a 1-800 number for a toll-free number. Call anytime, and you'll be linked with a counselor who's either probably a member of the Ontario College of Social Workers, and will be able to help that person. And also, if anyone is looking for specialized community services, Canadian Mental Health is still running operations as usual. Obviously, a lot of our operations have changed a little bit due to the urgent care clinic opening up, and also doing more phone support when possible. But if anyone is requiring case management, so weekly check-ins, someone just experienced a psychosis for the first time, they need justice supports because they just came out of jail, for example, or if they need counseling or bereavement supports, all those services are still available. So I would just recommend calling the CMHA phone number to ask to get connected with those services if you're looking for any sort of specialized mental health or addiction services in the community. And for anyone who's already a Canadian Mental Health client, this is just a breakdown of what we would recommend. So if you're in crisis, obviously the first line of we would recommend for emergencies is to call 911 or to call the local crisis center line. Or if they're not in crisis, need help to contact their worker, and if they cannot contact them for some reason, to call CMHA and ask to be transferred to leave a message for their worker. Scheduling appointments, again, call their worker Canadian Mental Health. You can still schedule telephone appointments. The injection clinic is still happening for anybody needing monthly injections for medications. And also the Crisis and Wellness Center, Transitional Stability Center is also doing the screening tool and they're doing their injection clinic as well. So that's still running. Urgent documents required. If you need copies of anything, you just call the reception. And unfortunately, all groups and trainings for mental health education have been canceled at this point because we cannot get together in a group of more than 10 people. But we are doing these webinars to replace that. And as Jenny mentioned, we're doing some training upcoming next week for Mental Health Week. So we're trying to do as much as we can possibly to provide education and training online. This is just a breakdown of phone numbers because the Mental Health and Urgent Care Center has a specific extension. So it's probably the easiest way to contact them is to call that phone number with that extension. The Crisis and Mental Wellness Center, that's the phone number as well. Community Crisis Line, CMHA. And for anybody who is not a teenager, maybe a little bit younger, you're looking for supports for children, definitely recommend calling Regional Children's Center Counseling Clinic. That's 519-257-KIDS. And these are all resources you can contact and connect by phone. And other additional community helplines and supports that have been started since COVID has occurred. One of them I just talked about is the Windsor Essex Support Line to contact a counselor on the phone. The others are, for example, a food helpline. So emergency food for low-income families and seniors who are self-isolating or require access to prepared meals. There's that toll-free number there, Monday to Friday, 8 a.m. to 8:30 p.m. There's also a Windsor Essex Senior Call Assurance Program. So that provides seniors with phone call security checks and referrals to local support services. So I would definitely recommend that for anyone that you know that might need a surety, who has a family member that may be a senior that might need these services. They're absolutely free. There's a toll-free number, and Monday to Friday, 9 a.m. to 4 p.m. It can be accessed. And also 211 Ontario, because services change a lot. It's and also if the services aren't necessarily provided in the language the person is native to, there's available in 100 plus languages, information and resources that are local if someone calls 211 is looking to access those resources in that language. So I always try to remember 211 because that's a wonderful resource. So if you're taking part in this webinar and you know someone or you're concerned about someone, these are just some straightforward tips that we'd like to share. So a lot of the time it's problems with our activities of daily living. Sometimes we just have trouble doing what we need to do every day, and everybody has the same supports as everybody else. So if possible, if you could offer help with everyday tasks or try to make those things easier for a person who is experiencing maybe some issues dealing with their mental health, try to make plans, try to keep a schedule, check in with people, and just try to connect them with supports in a compassionate, respectful, and caring way with empathy, because usually we need to be kind to ourselves and others when we're going through a difficult time. So those are basically just some straightforward, it's kind of common sense, but it can be kind of difficult to do when we're not feeling our best too. So definitely even accessing things like Bounce Back ourselves or going on Big White Wall and making an account and anonymously talking to other people who are maybe sharing similar experiences or learning more about like our own emotional intelligence or our own emotions, and using those apps will help us kind of better assist others over time. And this is just to summarize a complete list of local resources, and this is from the Public Health Unit's website, and I will put this in the chat box as well right after I finish presenting this part. It just overviews a lot of information that I just went over. So like the Community Crisis Center, the crisis line 509-973-4435, the walk-in services from 8 a.m. to 8 p.m. at 744 Let, and also the emergency department to access that if needed at the OLET campus, Windsor Regional Hospital, Canadian Mental Health Canadian Mental Health Association services like bereavement, serious mental health issues or illness, substance use issues, and other specialized mental health supports. And right now, to try to meet the need of the community, anyone who presents at the Mental Health and Addictions Urgent Care Center will be assessed and will be connected to services as needed based on the assessment. So other things, Family Services of Windsor is still taking appointments. So if you're looking for counseling appointments, they used to do walk-in and they used to do in-person appointments at Family Services, but right now it's switched over to telephone appointments. So you could still access these services. A lot of EAP providers, so if you have EAP benefits through your employer, a lot of the time it may be Family Services, so they are an EAP provider. So if you need to access your own benefits, to contact Family Services or contact another service for counseling to use those benefits, they will still provide counseling. It would just be over the phone. So I just suggest doing so. Although depending on the funding and sliding scale of how much things cost, it may be covered for some free sessions, but there also may be a cost involved. So just a heads up in those terms. Financial fitness services, they do financial counseling and education services through the financial fitness program. It's free budgeting sessions, debt management. Right now they're doing telephone sessions. Usually you would have to go in the office and meet in person, but they're doing telephone sessions at this point and doing all those consultations on the phone at this time. And that's through Family Services building as well. In the Connect Ontario, there's a detailed description of all these services and other services like gambling issues, substance use, mental health issues. Some things that we haven't necessarily covered here can be found on connectontario.ca. So I recommend accessing that as well. And the last few things is basically the online social supports and life skill supports that are CBT based or just getting a counselor on the phone. They're Big White Wall, Kids Help Phone, and Bounce Back Ontario, which Jenny already has gone over in full detail. So just a reminder. And I saw today a post from a Kids Help Phone stating that if someone is a family member, a youth, and their family member is in the military, there's a specific thing you're texting. Jenny, I can't remember the exact code you put in, but if you do 686868 and put a specific word there, they'll know that you're a youth from a family member. So Kids Help Phone anyone who use age 29 and under, they could text, they could go on the phone, they could go on chat lines and access a counselor right away for support. So yeah, I'm gonna just say thank you. I want to leave some time for question and answers. So I'm gonna stop sharing my screen and just open it up to everyone. So does anyone have any questions, comments, anything we did not cover that you may be interested in? Please feel free to ask in the chat box as well.
I have unmuted myself. So the crisis text line for military children and youth, it is CAF Kids. So when you're texting Kids Help Phone, which is still the 686868, you would then put CAF Kids. Also, yes, all the slides are going to be available for reference. I think we have had we put a lot of information into this webinar, and we did it really purposefully to be able to, create a PDF, to be able to send everyone the slide deck, to have the visuals of what those apps look like, and to be able to, maybe you are supporting someone and you want to be able to print something off and just send it to them or email or, so we will definitely send everyone a slide deck of everything we spoke about here as well. I did put in the chat box something really awesome as well. We're going to try our best to be posting it on our Facebook, Twitter, or Instagram accounts for CMHA. The Working Mind, the Mental Health Commission of Canada, they also, really are coming up with some innovative, creative ways to host some webinars as well. So there are a couple that one is called Caring for Yourself, Caring for a Team Member. So you can find that at theworkingmind.ca. I put it in the chat box. And I will remember to kind of put all that into the slide deck as well. Next week, we start Mental Health Month. Evelina and I are actually going to have another webinar. We really want it to be focused on education/discussion, and it's on May 7th. Details to come. I think I'm going to post everything this today. And it's just called Let's Get Real About Mental Health. And we really want to have an open forum where everyone is safe to, we want to have a conversation about, the stigma and when we say we're okay, but we're not okay. And, what does that look like? So we really want to, encourage people to join us for this webinar next week. It's going to be on Thursday. Again, details to come on, we'll be posting it on our socials, but we really want to be more of a discussion based because again, everyone is their own expert in their mental health, their wellness, their recovery journey. And it's important that we hear those stories as well. Oh, yes. Somebody just said that they've tried Insight Timer. I adore Insight Timer. So maybe I will tell people briefly what Insight Timer is. So Insight Timer, I adore it. It's an easy app. And the reason I like it is that's kind of how I introduced myself to, simple guided meditations, relaxation practices. And, sometimes the whole word meditation would scare me sometimes because I thought, oh, I can't keep my attention. What if it doesn't work? Insight Timer is free. And what's really nice is I would seriously search sleep 2 minutes, not able to sleep. So it gives you some different guided meditations. So again, it's called Insight Timer. It's a really good one. So thank you for letting us know about that as well.
Jenny, I just had a question from Candace about how many sessions can a client receive at the urgent care center at Windsor Avenue, or it's just crisis. So if someone needs to have access, just like someone usually before this urgent care, if they didn't go to the transitional stability center or the crisis center, you usually do an assessment, right? Because we need to gain information about what's happening. So and the great thing about the urgent care center is that there's a whole team of people who do appropriate assessments. So if they're presenting with an addiction issue, there'll be an addiction counselor and potentially a physician who could see the person, assess what's happening, and provide the appropriate resources and appropriate follow through after that. So it's not necessarily like anyone can go there really any time to be assessed. There's not a specific amount of sessions or a specific amount of time someone can go there, but the whole point is to be assessed and to be connected with appropriate services and appropriate help and treatments for whatever the presenting issue might be. So so yeah, that makes sense. So say if you go to urgent care, you broke your toe, they say, okay, your follow-up is to rest and do this, and then come see me in 4 weeks, then that's what you might have to do. So it's a very similar kind of model.
You're welcome, Candace. There you go. Any other questions? Well, thank you all for joining us today for this webinar. You know, it really is, you know, we're inundating individuals with a lot of supports, but, you know, sometimes it seems, you know, we start to get stressed trying to figure out, you know, where do I access the support? What's available? What's not available? It's hard to keep up with so many changes, you know, with certain restrictions due to COVID-19. You know, we thought it would be really, you know, actually, this wasn't our idea. It was, we put a poll out, and someone on Twitter, you know, indicated, you know, hey, you should really talk about, you know, what are those access to supports? What does that look like online and locally? So for the individual that gave us that recommendation, thank you, because we also thought that was such a great webinar of choice to be able to do for everyone. So there you go.
And also, this will be recorded and posted on our YouTube channel. So we will definitely post it on there in the next day or two. Yeah, there's a lot of support to Windsor Essex, and also it's the whole point is it's hard to navigate it, especially if we have new services opening up like in the last month. For everybody to be aware of them, things have changed so rapidly. So yeah, it's great that everyone's interested and just follow good sources for information. That's why I like the public health units, and we update our CMHA website as well. And Jenny, we have a question about assist.
I know, and I was like sad face. You know, suicide prevention and suicide prevention training, you know, it is absolutely essential. And unfortunately, you know, due to the social distancing, we're not able to do that right now. We do have one scheduled for June 25th and 26th. Evelina and I are extremely hopeful that we'll be able to, you know, continue with that training. Having said that, if, you know, some of the restrictions have eased, if we're able to still continue social distancing, maybe we might just, you know, reduce the amount of participants to ensure all are safe. But we really want to, you know, that's an important training. Anything to do with suicide prevention and building those tiers of suicide safer communities, I think it's absolutely essential. So we really do want to pick up and start those trainings, and we will let everybody in the community know when we start doing that. So thank you for that question. Okay. Well, thank you all very much, and stay tuned for some new webinars, and please join us next week or any webinar in the month of May, as we really want to showcase and highlight the importance of speaking up about our mental health and wellness.
just sharing our email for mental health promotion. So that's our email, mhp@cmha-wcb.on.ca. If you have any other questions about resources in the future or whatever it may be, please feel free to email us and we'll get back to you as soon as we can. And we will share the slides as well, as Jenny mentioned.